Dramatic events are common in the world today. News of wildfires, hurricanes, tsunamis, and wars just aren't startling to anybody anymore. Nowadays, people don't concern themselves with events because they hardly affect them personally. Why concern yourself with an issue that doesn't affect you? The truth is, for many, the tragedy continues long after it is over. Some who survive traumatic events, such as those mentioned before, are haunted long after. This is called post-traumatic stress disorder, also known as PTSD. It's a severe anxiety disorder that develops after witnessing a traumatic event. War veterans are most commonly known for developing this disorder after returning home from combat. As a military dependent and someone who cares about the well-being of veterans, I feel like this is an issue that needs to be addressed. It's sad to think that veterans come home from serving their country only to fight another battle at home. Veterans with PTSD need to be given priority treatment because they deserve to be able to escape the nightmares that haunt them. Post-traumatic stress disorder is very common, especially within the military. Those who see combat are at especially higher risk. While in combat, military personnel are sometimes put in terrible situations that would give anyone nightmares. The percentages of veterans with PTSD originating in high combat operations from the last 6 decades are particularly shocking. 20% of veterans who served in Iraq, 12% who served in the Gulf War, and 30% who served in the Vietnam War have developed PTSD at some point. The percentages represent only a small fraction of the overall number of lives affected by post-traumatic stress disorder. For people to receive treatment for PTSD, they have to have a medical diagnosis. There are opponents who believe this disorder can be overdiagnosed and misused. I cite incidents where veterans have even reported doctors attempting to diagnose them with PTSD simply because they served overseas, bringing into question all diagnosed cases. However, without a diagnosis, those experiencing the symptoms of PTSD have no avenue to get the help that they need. Throwing out the treatment of PTSD patients due to the incorrect diagnosis of a few cases is like saying no one, anywhere, anytime should be allowed to use pain medication because there are some people who don't need it, but are able to find doctors who knowingly prescribe it to them anyway. The abuse of some doesn't mean that those who really need it should be neglected or ignored. The fight for military veterans with PTSD continues even after they return home from combat. Victims of PTSD are constantly haunted by its symptoms. They relive the trauma through nightmares and flashbacks that can be triggered by almost anything: sights, smells, sounds, even feelings that take them back to the trauma. Everyday activities can change into a nightmare in an instant. For a veteran with PTSD, simply slamming a car door a little too hard can send them back into the line of fire, with machine guns sounding and grenades exploding all around them. They can also have extreme anxiety and feel disconnected from everyone. Those with post-traumatic stress are not the only ones who suffer. The family members of PTSD victims are also affected. After returning home from combat, a veteran with PTSD may act like a completely different person and develop strange behaviors that are completely uncharacteristic. The family may not understand or know how to cope with the changes, and divisions can form within the family. It must be hard to have to deal with problems that are out of one's control, but then compound that with worrying about the family problems it causes as well. The cases of domestic violence and verbal abuse are higher amongst those who have served in combat zones than those who haven't. Often attorneys and opponents claim that the diagnosis of PTSD in these cases is just a cop-out defense to keep people from having to face the consequences of their actions. They allege that PTSD is easily faked and can be a get-out-of-jail-free card when veterans get in trouble. Although it is sad that people would misuse a tragic disability to protect themselves, PTSD is a serious disorder that people really do suffer from. The truth is that proper diagnosis and treatment could prevent many of those tragic events from happening. The rate of veterans with PTSD who commit suicide is at an all-time high. These veterans feel like they can't escape the trauma that haunts them and feel like their only escape from the nightmare is through ending their life altogether. veterans have a suicide rate 50% higher than those who have not served in the military. 3 years ago, veterans accounted for 20% of the suicide rate in the U.S. Today, an average of 22 veterans commit suicide every day. That's 8,030 deaths in a year. Veterans with PTSD are often overwhelmed with depression, guilt, and anxiety and don't know how to cope. There are those who would argue that since suicide is so common today, veterans with PTSD aren't the only ones who take their own lives and shouldn't receive such focused attention. Though suicide is a massive problem that should be addressed whenever possible, military personnel who serve in wartime battles are exposed to much more trauma than the average person, and there are a known group who experience this disorder at a much higher percentage than the general population, so actively addressing a known problem is only logical. Bringing attention to the problems of PTSD in the military does not limit the treatment of those others. In fact, the exposure and knowledge gained through treating military personnel can only help further the development of better forms of treatment for all people experiencing PTSD. Despite the opponents that claim PTSD is being misused, misdiagnosed, faked, and even its treatment unfairly directed, the truth of the matter is that PTSD is a real, devastating disorder that affects combat military personnel more significantly than any other portion of our population. Their claims do not add legitimacy to preventing diagnosis or treatment for those who are truly suffering from this disorder. Aggressively targeting treatment of those who are more prone to PTSD's damaging effects is the only sensible conclusion. Why not take preventative measures to treat the disorder before it causes further damage to relationships, families, and lives? Something must be done to help our veterans with PTSD. One of my favorite sayings is, "Be the change you want to see in the world." That's why I decided to do what I could to help out in my own hometown. I designed a t-shirt to promote PTSD awareness. The front shows our troops standing in front of the American flag and says, "Freedom isn't free." The back says, "Some dream of being a hero, others relive it in their nightmares." I've been selling them around my community and have even sold some out of state. So far, I have managed to raise over $200. All of the profits from this project are going to a veteran's best friend, our local Cabot PTSD service dog training ministry. For those of you who want to help but don't know how, it doesn't take a lot. Even baby steps will help you reach a long-term goal. For anyone interested, it's not too late to order your shirt today and contribute to helping local veterans with PTSD. Even through small acts, like buying a t-shirt, you can be the change you want to see in the world.